이번 세션은 Market Entry Strategy라는 주제로 전문가들의 다양한 견해를 들어보는 패널 토론 시간입니다. 패널분들이 라이브로 준비를 해주셨는데요. 먼저 패널 토론의 연사분들을 소개드리겠습니다. 우선 본 패널 토론의 좌장을 맡아주신 DITA GP Dealmaker 토니 휴즈 님입니다. 어제 저희 첫 번째 세션을 맡아주셨었고요. Q&A 세션에서도 한번 뵀었죠. 그리고 패널로는 JMB Partnership의 제임스 블레이크모어 님, 그리고 NIHR의 Head of North Korean Dr. Peter Sargent 님이 참여해 주셨습니다. 본 패널 토론은 영어로 진행됨을 알려드리며 화면을 통해 라이브로 만나보시겠습니다. 그럼 본 패널 토론을 맡아주실 토니 휴즈 좌장님께 마이크를 넘기겠습니다. I will now pass the floor over to you, Tony. Please feel free to take the lead.
Thanks, Juliana. Good afternoon, everyone. I've got two really good speakers for you today. I think the most difficult thing for companies who are crossing borders to do business is to come up with a strategy that takes their product or service that has served them well in their own market and to take that into a different market, because obviously you're dealing with different cultural factors, but you're also dealing with a lack of knowledge about how the market you're selling into operates, how it works. I think one of the best things about the UK as a business environment is the presence of lots of organizations who just exist to help companies like yours to find that route into the marketplace in terms of how you come up with the right strategy and the right implementation of that strategy to enter your market. Some of these organizations are very broad, so they work with all companies across sectors. And there are some companies that work with companies in particular industry sectors. And given most of the companies who are in this group and listening to this today fall broadly into two camps, which is either working with data or using machine learning technologies or artificial intelligence to improve service deliveries across different sectors, or looking at how they can use their product in the healthcare sector. I've got two speakers that address those particular problems. I'm going to let them introduce themselves because they each have a short presentation to give to you, which will explain in more detail about what they do. And then we're going to have a little discussion. And at the end, if you have questions ready for them after you've listened to their presentations, you can ask them questions, either put it in the chat or raise your hand. So first I'm going to turn to James Blakemore. So James is Managing Director of J&B Partnership. And James's company has vast experience of helping companies like yours, companies from overseas who are coming into the UK marketplace, and very much works in the B2B space and helping companies come up with the right sales and marketing strategy. So without further ado, I'm going to hand over to James. James.
Thanks, Tony. I'll just put my presentation up. Hi everybody. Thanks for joining us. I was going to say this morning, but as I say, this afternoon, your time. I just want to give a bit of background into who we are. I'll just give a bit of context, and really pleased to be answering questions later and talking through some of the topics, some of the common themes that we find for international companies coming into the UK market. So J&B Partnership, I set up, seemed like yesterday, but it was 15 years ago. We're a family business set up with my father. We come from a B2B sales background. My first job in sales was with manufacturing businesses, actually automotive businesses. But what we found very early on, our original business plan was to work in that space. But through the power of the internet, we were approached by many international companies, all with the common theme of, we're looking to enter the UK market. We think there's an opportunity for us. We want to sell into the market, but we need some help on the ground to do that. And that's when our whole business model flipped within 3 to 6 months. So where we are now, we're an international business working across various different markets. But our common theme, around 80% of our business, is actually international organizations all looking to increase sales and to make sure there's validation of the opportunity. Obviously, with companies, the reason they're looking to come to the UK in most cases is that they're very successful in their own market and want to replicate that. And so we help them do that, because sometimes, whether it's cultural differences, whether it's legal differences, you might just need to change some of the approaches that have worked for you when entering the UK market. And I'll talk a little bit about how we do that. So just some of the headlines about who we are. We've worked with over 700, it's actually over 1,000 now, international companies in that time. So we've seen pretty much all the things that can go right, all the things that potentially could go wrong. And through that, and that understanding of where the marketplace is and what companies have done well, leads us to be able to work with companies and help speed up the process, and also make sure they don't make the sort of common mistakes that can happen without that help, support and guidance. Around 60% of our clients would be companies who have actually set up a physical office in the UK. In most cases, that might be 1 or 2 sales staff or 1 or 2 support staff, and we help that member of the team to generate these opportunities. The other 40% would be those organizations who haven't quite set up in the UK, are looking to validate the market and are looking to generate some revenue through first customers to then expand further into the UK market. So that's a sort of mix of who we are. One of the proudest moments as an organization was when we won an award. Obviously fantastic, you guys have won this award, which is great. We won a Queen's Award for international trade, which is known in the UK as one of the most prestigious awards. Ended up meeting the Queen at Buckingham Palace, which I didn't think when I started the business I would talk to her a little bit about what we do, which was a very surreal. It was only for about a minute, but it was a good thing to do. And so we're very, very proud of the work that we do. As I said, our key is around lead generation, generating leads, and we do that in a number of different ways. On this slide, you can see the different activities that we undertake, and I'll talk a little bit just in the presentation about some of those specifically. But it's around understanding our client's business, understanding what they're looking to achieve in the UK market. We put together a strategic plan alongside them. So obviously our clients know their business more than anybody else, but we can give a sort of, if you like, fresh eyes approach to what they might need to do to enter the UK. Once that plan is built, we generally would build a contact database of prospects we would like to reach out to. And then we generally use 3 different tactics to achieve opportunities. And in most cases, that's setting up meetings on their behalf. So those tactics are LinkedIn. So we've seen a growing trend, especially in the past 12 months. I know we're talking later about what the last 12 months have and what the future might look like. But we have seen LinkedIn has been a fantastic tool for our international clients to be able to reach out. With a high number of people working from home currently in the UK, there does seem to be a higher response rate, that direct inboxing, whether that's through using Sales Navigator or through using InMail, some of the subscription services that LinkedIn uses. There can be a very cost-effective way of generating opportunities, and we run a lot of campaigns on behalf of clients for that. The other area that we work in detail is around content creation, and having what I mean by content creation is things like PR, information, white papers, testimonials, case studies that we push out to the database through email, automated marketing, where we set up different journeys that people would receive that content. And that's, again, a very engaging way for the market. Again, we have seen open rates of emails go up in the past 12 months. Again, I think there's more people working from home. There's a bit more time for people to review their emails rather than a straight delete. So that's a growing trend that we'll see what happens in the next 12 months. And then our core area is around telemarketing. So it's a very traditional way of generating leads, but one that I firmly believe is the best way to get direct feedback from the marketplace. It works really, really well if you have a very defined audience. If you have a prospect list of between anywhere from 50 to 500 to 1,000 leads, then actually you can spend the time and resource to try and speak to those organizations, understand where they are in terms of their need, and also get that direct feedback and to unearth the opportunity. If in your specific product that actually there's a potential of 100,000 customers, then telemarketing probably isn't the way you would focus your resource. Then you're doing a more automated approach with regards to social media, email marketing, etc. But in that defined space where you know your audience, in my opinion, telemarketing is a key area. Just put this slide up, and you might think, well, why have you put a startup up? We're all established businesses, but it's one of the most common. People ask me, what is your one piece of advice you would give? It's you've got to think like a startup, in my opinion, when you enter the UK market. What I mean by that is we have seen companies who have maybe struggled when entering the UK if they think that because we're well known in our own market, in our own country, we can just rely on word of mouth. Obviously, when entering any new market, you have to spread the word and build a reputation and build a brand in that marketplace. So however big you are as an organization, when entering a new market, and in this case the UK, I would say that actually that those companies who have seen it as a new business, as a new challenge to get the word out there, have been the ones that have been most successful. So it's just a thought, something to provoke thought in terms of thinking, how you can achieve success. It's one of the last slides, but hopefully this gives a view of what we're trying to say is, if you just do one thing or one piece of activity, probably you will struggle to resonate and get traction in the market. What we're showing with this slide is that actually by a joined up process, thinking of different ways of building your presence, as little as having some content on your website that talks about the UK market, that maybe talks about some of your references in the UK to back up all the other activity. As an example, if you spend lots of money, do lots of resource, and you make lots of phone calls and you send lots of emails, but then you don't back that up with some relevance or some you're saying a different message on your website, that work has gone to fail. But if that website then backs it up, even if it's what we would call a campaign website, so maybe a specific UK focused website to run alongside your main corporate website, those are the sort of things to think about, so it backs up everything that you do. One of the other things I've just mentioned, and it's on there, is trade shows. Obviously, in current times, it's more difficult, and there's virtual events. Obviously, there's London Tech Week, which you guys may be aware of. One thing we would say is that in normal times, when you can go to a trade show, it can be a great place to network, but also to put lead generation around. And what I mean by that is doing your preparation, understanding who you would like to speak with, who you'd like to meet at those events, and don't rely on just having a stand and hoping someone will walk past. So encompassing and combining and working together with all the other activities, these are the sort of things to think about to gain that traction. I won't talk too much around data because I think we're going to cover off some of the points during the question and answer session. But I just put this slide in there because data is the key to any lead generation project, whichever market you're in. If you get the wrong data at the start of the project, it is doomed to fail. If you spend a bit of time and look for quality, quality data, that's going to be very successful in the long run. And there's some very easy, very obvious things you can do to make sure you have that right data. A lot of it's about analyzing your existing customer base and looking for UK companies that have a similar profile. Obviously, from a risk point of view, it makes sense that similar organizations that are already your customers would be the same in the UK. And through a number of different data houses and through data brokers, you can get together a very strong list based on a number of criteria and credentials. So I would say it's very much worth doing that research to get the right data. Telemarketing I've talked about already, giving you a bit of an understanding. I think probably it's fair to say 10, 15 years ago, probably when we first set up JMB, Telemarketing was very much you build a list of companies from A to Z, and you call them, and then you call them again, and you probably call them again. Where the industry has moved to now has been a bit more sophisticated by utilizing technology to really hone in on where your warm leads are. And so that's where, coming back to that other slide, combining different approaches is the key to get the intel as to who you want to really focus your time and resource and who you want to speak with in the marketplace. LinkedIn, again, I've already talked about, so I won't go into too much detail, but you can see some of the stats on the slides. And understanding different markets, there's different providers for B2B networking. Very much in the UK, as much as anybody else might say there's other organizations, in my opinion, LinkedIn is where the industry and where business does communicate. And it is something that with any UK market, with any UK prospecting, I do think having some sort of UK content on LinkedIn is a key area, as well as helping you generate leads. It's a fantastic tool that I think is very cost effective, as I mentioned earlier. That's the sort of key part of the presentation. I hope to give you a bit of context as to who we are and what we do. And as I said earlier, I'm really pleased to be answering any questions and to going through the discussion to go in more detail. Thank you. Thanks, Tony.
Thanks, James. That was great. Very, very good point on LinkedIn, everyone. If you don't have a LinkedIn profile and you are entering the UK, you need to have one, both for yourself and for your business. Right. Thanks, James. We've got Dr. Peter Sargent, who's head of the NOC unit of the NIHR, who's going to present what they do for 10 minutes, and then we're going to jump into questions. So over to Peter.
Cheers, Tony. Thanks for the introduction. So as Tony mentioned, I'm Peter Sargent. I'm the head of business development for the National Institute for Health Research. And in my slides, I'm just going to give a quick introduction to what the NIHR is and how it can help companies developing innovations in the healthcare space access the UK's National Health Service, the NHS. And then we can go on to describe a few kind of examples of how we've supported companies. But to start off, what is the NIHR? So the National Institute for Health Research, we're actually a funder, and we're the largest funder of healthcare research in the UK, managing just short of £1.2 billion a year on behalf of the UK's Department of Health and Social Care. And what that money is focused towards is to finance the researchers, the facilities, the people across our health system, across our partner universities and social care, in order to enable to deliver and evaluate new health innovations and adopt those innovations into the health system. So the best way I usually describe the NIHR is really where that funding is focused, as you can see by the pie chart on the right of the screen. So, and about 2/3 of that funding goes towards what we call infrastructure. And what I mean there is primarily investing and funding researchers across the health system. So what we're doing here is we are buying the time of clinicians, academics, research nurses across the health system in order to be able to deliver research and evaluate new innovations. So, and that's the term I use there, buying the time, is an important point to kind of get across, because we are buying the time of clinicians. A lot of these clinicians are also treating patients within the clinic. So they are active clinicians and medics, which also has had an effect during the pandemic as well. When we were super busy in the hospitals, some of the research had to be deprioritized. But I kind of wanted to make that point. So that's about 2/3 of the funding, and we fund about 25,000 researchers. We also focus around about £100 million a year on our NIHR Academy, and what we mean here is this academy basically funds the kind of the fellowships, professorships, all that kind of training to ensure that all those workers, that workforce, is upskilled to be able to deliver the highest quality of research possible. We also then focus around about £250 million a year towards our research programs, our funding programs. So these are a variety of different competitive grants, both commercial and academic innovators can access to help finance specific pieces of research. So as an example, if you are a company with a new innovation and you are looking to carry out a proof of concept study within the NHS, then we can potentially provide finance or funding to help finance that piece of research. So that's kind of the NHR. How the UK compares to the rest of the world when you look at clinical research, we are a very active country when it comes to clinical research, and actually just focusing in on just the commercially sponsored research and looking at the volume of research coming through the UK, we're actually just behind the US in second place based on volume. So, you know, compared to the world, we are running a lot of research. How that translates into what those trials look like, what the recruitment looks like. So in 2018-19, we recruited around over 46,000 patients onto commercially sponsored research. That is actually only a small proportion of the total people involved and recruited onto research in the UK. I think last year alone, certainly with some of the vaccine studies, we recruited a total of 1 million, just over 1 million people onto research. But commercial is very important. Looking in on our health, on our NHS and our health system and how active they are, that is within, you know, evaluating new innovations. 100% of our NHS trusts, so these are hospitals, are actively evaluating new innovations, are getting involved in both academic and commercial research. So that's like kind of secondary care part of the health system. But then if you look towards our general practices, so this is our primary care clinics, almost 40% of them are also actively recruiting patients onto clinical research. So we are a very active country when it comes to this. So how does the NIHR support companies more specifically? So as I'm sure all of you are aware, especially those who are developing health innovations, there's really kind of two types of evidence required to take your innovation really off the bench and then through into the health system. There's that evidence which is required for regulatory requirements. So depending on your class, your regulatory class of your product, there may be evidence requirements, or clinical evidence requirements to show its performance and its safety. But also there's that evidence requirement to help you build your value proposition to take to the NHS and say, look, this innovation is great, it's going to benefit you in these ways, and it's going to have this cost benefit as well. So the types of evidence include things like, you know, understanding how your health innovation will impact care pathways. So is it going to alter new care pathways or create new care pathways in the health system? Creating evidence around clinical performance. So does your innovation do what it's meant to do? Does it actually help treat the patients? Looking at the clinical utility and the human factor evidence. So your health innovation may be the best intervention ever, and it may be treating patients. But if the medics cannot use your innovation, or they struggle to use your innovation, then you are going to struggle to get that innovation adopted. And then lastly, look at evaluate the cost effectiveness of your innovation, so the health economics. So all this together is very important when you are looking to access the NHS market. And the NIHR can really support you, help you generate all those those components. If you're familiar with technology readiness levels, the best way of thinking about how the NIHR can support is really from as early as TRL 3 right through to kind of 9 and into adoption. However, if you do engage with us in the NIHR, we don't just stop there, and we can certainly support you navigate the wider UK research and health system. So whether that is connecting into some of the organizations which are focused more around adoption and dissemination of innovation, We can help you access the regulators and the ethics bodies to understand what evidence and regulatory requirements you need to follow within the UK. And also we can connect you into the wider system, so with the government bodies, health tech clusters across the UK, or other funders who may be able to help support financing your innovation. Focusing back in on clinical research, there are a number of ways which we can specifically support you. So as we are the largest funder of healthcare research in the UK, we do have a very unique view and vantage point on all those researchers across the system, all those 25,000 plus researchers. So we can help connect you into and help you set up collaborations with leading clinicians and academics across the country. So for instance, if you are developing a health tech product which looks at diagnosing Alzheimer's, for instance, a neurological disease, we can certainly identify the leading experts in both neurology and Alzheimer's, and also evaluating digital interventions and help you connect into those. We can also support you connecting into certain facilities, clinical facilities and clinical tools. So if you need to evaluate your innovation within a certain environment, such as like an operating theatre, or use a specific tool to evaluate it, we can help you do that. We can support you in set up and deliver clinical trials, whether that is your early single site proof of concept studies right through to your large national multi-site trials. As I mentioned, we can help you access funding to help finance your research and your evaluation. We can support you gain access to data, and data is important for a number of different reasons here. We can support you gain access to both research data and health data to either evaluate your innovation or understand where your innovation fits within the system. And we can perhaps discuss that a tiny bit later. And then lastly, we can support you obviously access kind of patients, whether that is patients for inclusion onto your clinical research and onto your studies, or access to patient groups to help feed into the development of your product and the development of your clinical strategy. So I'm going to stop there, Tony, but obviously if you do have any questions, or you think that engaging with the NIHR could benefit you, I'll be very happy for you to get in contact with me directly, and we can certainly help. Thank you.
That was great. Obviously, with the NHS, the world's largest integrated care data system, accessing data, or showing how you can integrate your application or services into that system is a key point we'll get onto in a minute. I just want to, because time is tight, for you each to maybe talk about a case study or case studies to exemplify how exactly your organization works with overseas companies. Maybe James, you can kick us off.
Yeah, no, happy to do that. So I guess one example of a client of ours was somebody who we work with, or we have worked with for over 5 years, and almost taken along a journey as they've grown and developed in the UK market. So the organisation is actually from Australia, a company called Maintenance Connection, software tech company. When we were first approached by them, it was to say, look, we're coming over to the UK. We want to meet with prospects. We want to see if there's an opportunity in the UK market. So the managing director came over to the UK, and we put together 2 weeks worth of meetings with prospects. Through those meetings, that gave him the confidence to say, yes, no, there is a market for us. We see there's been opportunities. He then decided to actually come and live in the UK for 6 months to take the business off the ground based on that initial success. We continued to work with him, generating him lead meetings and leads on an ongoing pipeline basis. That then led to his first 3 or 4 customers in the UK, and actually broadened into Europe as well. And one of the things about the UK market, it can be also a gateway into European clients, as well as organisations the large organisations have offices all over Europe. That then resulted in him employing us, helping to recruit his first employee in the UK, and now roll on 10 years of being successful. They continue to grow, develop, and are upwards of 6 staff. And for him, it was around really doing that research, understanding the market, validating the opportunity, and then having someone like ourselves to be able to open the doors on their behalf. And now they have some of the largest UK companies as clients of themselves. So obviously we would consider that a success of an organisation entering the UK.
Thanks, James. Is that I was going to ask you, is that typical of successes that you have coming through? Do you tend to work with companies at different levels for different durations of times?
Yeah.
Is there a time at which you say, well, okay, well, actually we work better with doing the strategy and the implementation?
Yeah, no, it's a real mix. So some of our clients are, we're working for them for a defined amount of time, say 6 to 12 months, very much in that initial stage. And then when they look to develop and grow their business, they obviously employ staff and they take on their own business. We have other clients where it might be a very specific piece of research that they want us to undertake on their behalf. It might be very much that introductory opportunity, and again they then take it forward as they grow and develop. We have others who are actually, they see us very much as part of their ongoing team. We had a US client who actually had 5, by the end of our engagement with them, they were up to like 30 staff in the UK, had five members of a sales team, but still utilised us for specific campaigns. So we're very much that flexible resource to enable companies to grow and develop. But also that, I think what I'd like to think that we do, along with other providers who are experts in helping international companies, we help companies not make mistakes and save time, which, as the cliche goes, time is money. So because we've been there and we've worked in so many different markets with so many different tech companies, yeah, I'd like to think we enable companies to speed up their development.
Yeah, it's a good point. Saving time, very important. I should imagine, Peter, for given that the health system is such the opportunity is there, but it's such a large beast that you have. I suppose your case study would be how effective you can triage all the requests coming in from your companies into the right areas, into the right partners, getting the right regulation set up for them, isn't it? Yeah,
no, completely. And I mentioned in my slides that we fund over 25,000 researchers. But if you look at the NHS as an employer, I think it's one of the largest employers in the world, employing over 1 million people. But I guess one example I'd like to give of a company we've supported, certainly one of the more recent success stories in the digital space, is actually a company called Nihr Medical Technologies, and they basically have identified challenges within the health system around mammography, so imaging of breast cancer. And actually there's, within a lot of these health systems, the radiology workforce needed to carry out all this image analysis is under threat. There's not enough new radiologists coming through. But also, as you can all imagine, the importance of diagnosing breast cancer early is critical in being able to treat it. So basically, Nihr Medical has developed an AI-based deep learning technology to analyze these mammograms and kind of detect cancer when it comes up. They then came to the NHR for support because they wanted to try and access the NHS, evaluate their innovation, and ultimately get it used. So what the NHR did and what we were able to do is we were able to connect them into various clinical experts across the system, including one of our hospitals, one of the leading oncology hospitals called the Royal Marsden, which is a dedicated oncology hospital. And through the Royal Marsden, they were able to access large amounts of data and images to help validate their AI algorithm. But in addition, they came back through the NIHR to access some of our funding programs I was describing. And they were successful in accessing one of the funding programs called AI in Health and Care Award, and were awarded off the back of that around about £13 million in order to help validate and progress their innovation within the NHS. So real success story. And now they are working with over 17 NHS sites across the country, evaluating their innovation. So getting, real good traction at the moment.
Great, thanks, Peter. I mean, I want to. We're at the end of that session. That went quickly. I'm going to open out for questions. We already have a question that's come through the chat from Ben. Peter, you'll remember iTrix because I know
yes.
you've already helped
Hello.
iTrix in connecting them with Manchester University. So Ben's got a very pointed question. I don't know if you can see it. I'll read it out. He says we are developing a clinical decision support system. Wonder whether this CDSS product also should go through the full registration process, or can it be simply recognized as an IT product that can be connected on EMR?
Yeah, good question. I think if it is an innovation which ultimately will be used within care pathways in the health system and potentially impacting patients, then it would need to go through kind of regulatory registration. And I would certainly recommend you engage with the likes of the MHRA, so the UK regulators. We can support you to do that, to understand what that regulatory requirements are. However, when we can also support you access those experts, those clinical experts and champions across the health system. And I'm glad that you've been able to connect into Manchester. They should also be able to help you devise your clinical strategy and what that route is and what the regulatory requirements should be around that.
Thanks, Peter. Do we have any other questions? Because I have a couple more before we close. Peter, just on that point of how do you triage all the requests that you have coming in, and then how do you then connect them to organizations or researchers? Are they often well-formed requests, or do you have to spend a lot of time in investigating what the company actually does and how it works?
Yeah, so the team I head up within the NIHR, we are all from kind of technical backgrounds, either medical or scientific backgrounds, working within product development and innovation development in the healthcare space. So a lot of our time in the first instance is get on the phone, or ideally, pre and post pandemic, meeting companies and talking through their innovation and their aims on what they're trying to achieve. And we can then certainly guide them in what their next steps are. We do stop short at offering official advice. I certainly wouldn't be here offering kind of official regulatory advice, but I can connect you into those organizations that would give you those regulatory advice. So I guess in the first instance, there's a little bit of triage, but we will always try and support you in one way or the other. Then the next stage is we would, on your behalf, reach out to those experts who are working in your space. And these are, the UK's leading experts in that field. And through them, they will be able to then give feedback as to where they see your innovation fitting into the health system, and what you need to do to take your innovation to market. So what that clinical strategy should look like and what that regulatory strategy should look like. So there's I guess a couple of a two-stage triage process in doing that.
Great, thanks, Peter. And James, there's about 5 companies who are on this call who are all developing software or machine learning or artificial intelligence techniques for very specific markets. So to your point of you tend to work best with companies who have a small group of clients. I suppose, how do you work best with these companies when they are in the age of, especially in the age of pandemic, not likely to be here physically anytime soon? How are you working with such clients to give them a better understanding about how they construct their runway into the UK?
Yeah, no, good question. I think obviously what we've seen over the past 12 months is that sort of traditional model of flying into the UK, having face-to-face meetings is obviously very challenging and has not been possible. But as Derek mentioned earlier, I think that obviously over the next couple of months, we see hopefully things opening up so that that might be possible in the latter, maybe potentially the latter half of this year, into 2022. But the process is still the same. So where you have a very defined market audience, one of the benefits of that is that you can really get to know individual targets and prospects, and so build some knowledge as to what's going on within the organization. What are the outside pressures? So what are maybe government talking about in terms of legislation if it affects that specific industry? What is the outlook for that sector that you're working in? It enables you to build your brand in that space. So again, maybe niche conferences, trade associations linked to that industry, rather than you joining up to a tech, which may be suitable for you, a tech industry body. Actually, who is your end customers and what are they members of, and really building a presence in that space. And then generally, if as an example, if you have only maybe a potential of 100 companies you really want to work with, actually maybe building a database of 5 or 6 individuals who work within those companies, and looking to find the ambassador in the business, the person in that organization who is on your side and really thinks there is a business case, and buy into what you're looking to help the company do. That person then enables you to understand and have a greater knowledge of what might be the ways into that organization. So I sometimes think it's if you had a product or service that 10 million companies or around the world could use, obviously it could be interesting, but actually having a very defined audience enables you to be quite what's the word I'm looking for, sophisticated in terms of your approach, and really take the time to see it as an individual prospect rather than just trying to send out 10,000 emails. You can just be a bit more personalized, and that's what normally resonates with the audience.
And you mentioned around you have an emphasis on telemarketing. I should imagine right now it's because everyone's at home and it's somewhat easier to reach in some ways. That's probably
it's interesting. So there's pros and cons, I guess, at the moment. So the negative is that most people are working from home. So if you ring the normal switchboard, in some cases there's not an ability in certain organisations for them to transfer you. But what we have seen is a growing trend towards giving out of mobile phone numbers of people direct, so that you can get hold of them. So in terms of ongoing lead gen, obviously you have to be careful not to bombard somebody with lots of calls, but you are then able to have very direct conversations with the decision maker. So we have seen, as I mentioned, LinkedIn and email rates go up, and then that sort of, if you like, positive and negative of the telephone side. But what we have seen, probably when we first went into UK lockdown back in March last year, there was a couple of months where the market took time to acclimatise to that change. But I would say from the summer onwards last year through to now, as Derek mentioned, the business community has been very, very resilient, and there is a real appetite, I feel, for growth and development, and to utilise the technology. Companies have realised that actually what saved them during the past 12 months, in most cases, was the ability to have technology. I wouldn't still have a business if we weren't able to use Zoom, or our staff were able to work from home. It just wouldn't have been possible maybe 20, 30 years ago. So it's really technology that's enabled organisations to continue. And I think there's my own feeling, and from the people, our staff making calls, selling technology products, software products, is that business do realise that actually they do need to invest, and it's the key to then growing as an organisation, having the right technology to compete against their competitors.
On that point, I mean, because I know that a lot of the companies all of the companies who are on this call, they have technology in the main that is new to world technology.
Yeah.
So there's an element of that where it's not just a widget people are familiar with. It's something that you're going to have to explain to a potential client and how it improves what their role is, what their job is, or the efficiency of that, or maybe makes them work in a slightly different way, but a better way. Are they, I should imagine you have quite a few of these. What does it change your strategy in terms of just selling a product that people are already familiar with?
Yeah, I mean, a lot of it's around case studies and proving the concept through organizations, wherever they're in the world, but that concept of how it's helped to improve them. But it does mean that content is really important. So things like whether it's white papers or whether it's published articles, where people can read it and then understand how it could change and improve their business. One of the biggest challenges is around budget. So we had one organization who had a brand new product to the marketplace, changed how retail businesses worked in terms of understanding their customer service levels. And when we first started making calls on their behalf, people said, well, we haven't got a budget for something like this. But over time, through that education piece, through getting in contact and updating organizations what US companies were starting to do around looking at technology enabling to facilitate these sort of understanding of the market, that whole thing changed the following year when budgets were put in place and companies were fighting over themselves to not be the last person to take and embrace this. So I think a lot of it is around where you have case studies, really making the most of those. As much as a nice PDF or a nice website saying how great you are is important, actually what you've done and who you've done it for is going to be the key to really get over to organizations how it can change and transform their business. But I do think companies are, what we've seen over the past 12 months is a growing realization is that those companies who have innovated early have been successful. Even you just look at e-commerce organizations and the supermarkets, those ones who've done very well were the ones who embraced utilizing technology to enable customers still to transact. So I think going forward, those new innovative solutions are very much going to be on the radar for companies who are looking to invest.
Yeah, exactly. And I suppose right now people are kind of, it's that push factor, isn't it? People are being forced to look at new ways of working, new ways of conducting business, and maybe slightly more open to new products and services coming into their company as well. Peter, I just wanted to touch on, I mean, a couple of the companies that you probably won't be familiar with, less like iTrix, but more on the product side in terms of med tech. Do you tend to find that med tech companies who have a discrete product, defined product, as opposed to doing clinical research, is an easier way into the UK healthcare system, or is it just a different path?
It's just it is to a large extent a different path. Certainly, we support companies at all stages of innovation, and we recommend that even if you have a rough proof of concept or rough prototype innovation, to actually start engaging with us early, because as I described in my slides, one of the most important elements of any health innovation is designing something which can be used within a system, not necessarily whether it performs well, but whether it can be used. So actually getting clinical input, clinician input into the design of your product or your innovation as early as possible is key. But yeah, the regulatory and evidence requirements for medtech and kind of in vitro diagnostics and digital are very similar.
Do you tend to find that companies come back to you at certain points of their development in the UK? Do you tend to get the initial hi Peter, can you help us do X, Y, and Z?
Yeah.
And then you, and then they come back to you 6 months later and say, "The next problem is this."
I think, I don't know the exact numbers, but certainly, 50, 60% of companies will come back and re-engage with us. Because, as you go down that path into accessing the NHS, there's different requirements and different people you need to speak to. So certainly we can kind of maintain that relationship as you go through your product development, and help you connect into those organizations and people at the right stages.
Yeah. And what's the contractual situation, if there is one, between you and the client? Are you a public body in the sense that you're there to help everyone, and there's no particular commercial contract or charge in that sense?
Tony and Peter, can we take this as the last question?
Yeah. Thanks,
Thank you.
Juliana.
Yeah, no. So so my team, the best way of describing my team is we are like a sat nav, a satellite navigation of the UK health system research system. We are actually a free of charge service. We don't charge anything for our signposting. So please do use us regardless. Where contracts and costs come in is when you start engaging with those sites to carry out research or gain consultancy. But those contracts will be with that local site. So say if you were to engage with Oxford University, you would go into a contractual agreement with Oxford University. If that makes sense.
Great, thanks, Pete. Sat nav, yeah, a great way of
probably underselling myself there. But.
Also, probably a great way for describing your name as well, in terms of being able to navigate your way to the right client and most appropriate client. I'd like to thank Peter Sargent and James Blakemore for giving their time this morning to talk to you, and thank you for listening back in South Korea. I hope that was educational for you, and I hope you picked up a few tips. I'm sure both Peter and James will be more than happy to connect with you in the days, weeks to come, prior to you hopefully arriving in the UK soon. And thank you for listening this morning. Thank you all. And thank you, Juliana.